Hi, I'm Dr. Gerard Guillory. I've been practicing in the Denver area for 25 years now. My interest is in irritable bowel syndrome. I've got some important things to share with you today. Today I want to talk to you about a special area of interest of mine, and that is probiotics. Now, what are probiotics? Probiotics are the beneficial bacteria that we all need in our intestinal tract in order to digest our food appropriately. You have more bacteria in your body than you have cells in your body, and these bacteria actually function as their own digestive organ, if you will. The easiest way to try and understand how probiotics work is to think about how yogurt's made. So if you want to make yogurt, you take milk, you add Lactobacillus acidophilus, which is a probiotic or a good bacteria, and then you slow cook or incubate the milk at 90-something degrees for a few days, and then you end up with yogurt. Now, if you were to take that same milk and leave it out at 90-something degrees without the benefit of the good bacteria, you're going to end up with sour milk. And a lot of people that come to me with irritable bowel syndrome, gas, bloating, diarrhea, constipation, a lot of these different digestive symptoms, they're making the gastrointestinal equivalent of sour milk because they don't have the right bacteria in their gut to ferment their food appropriately. And there are a range of problems that can occur as a result of this. I mentioned irritable bowel syndrome, which is one of the most common digestive disorders. I actually wrote the first book for patients with IBS back in 1989 and have studied this for a long time. And I'm here to tell you the majority of patients with this particular disorder will have a dramatic improvement just with the addition of a good probiotic supplement to the diet. But it doesn't end there. Inflammatory bowel disease, Crohn's disease, ulcerative colitis, and a lot of symptoms not really related to the gastrointestinal tract can occur. Because what happens is, to the extent that you have these bad bacteria in your gut, the immune system is activated. And anytime your immune system is activated, you're going to get a host of downstream problems, from chronic fatigue syndrome, joint aches and pains, muscle aches and pains, susceptibility to other food intolerances because your food is not being broken down appropriately. So this process of transforming dairy into yogurt is what we call fermentation. And it, for example, occurs with other foods. And a problem here in the United States is that we don't eat enough fermented foods. If you look at Japan, for example, where miso soup is a staple in the diet, they don't have the incidence of colon cancer and some of these other problems. And the evidence now would suggest it probably is their intake of probiotics on a regular basis, which accounts for this difference. It all starts in the gut. If you don't have good gut health, you will never achieve optimal health. So I recommend for everyone to take a good probiotic supplement, particularly if you have digestive problems, and particularly if you're not eating a lot of fermented foods on a regular basis. I have seen countless patients where this simple intervention has made a huge difference in terms of how they feel. I have a program that I call 10 Steps to Better Health. Step number 1 is the introduction of probiotics into the diet. So when you don't have the good bacteria, you've got pathogenic or disease-causing microorganisms, or you've got yeast in there, for example. Your immune system is activated, and then the lining of the immune system, or the lining of the intestine, becomes damaged, and then you end up with what we call leaky gut. Think about this for a minute in terms of trying to understand leaky gut. If you were going to make a cup of coffee, and you took that coffee filter, and you punched holes in it, and then you poured the water in, you're going to end up with a bunch of coffee grinds that you don't want in your coffee. The same thing happens when the immune system is activated because you have the disease-causing microorganisms. The lining becomes damaged, and now you get these larger bacterial and food particles into the bloodstream. That further activates your immune system. Things that you wouldn't even think about, like autism, for example, have been associated with probiotics or a lack of good bacteria in the gut. And the list keeps growing the more we understand the important role of these beneficial bacteria in the gut. So just remember, whether you have digestive symptoms or not, everyone needs to take a probiotic supplement. And the range of things that this might benefit is pretty large. It's also important to try and get some fermented foods in your diet. We recommend that if you're not going to take a probiotic supplement, to at least try and get some fermented foods. I mentioned miso soup, that's one example. There's sauerkraut. Yogurt has the good bacteria in it. Have you wondered why you're seeing so many ads now on the news for mentioning probiotics? You're going to see more and more of that sort of thing. Kefir or kefir is another good way to get probiotics into the diet. It's like a liquid yogurt, if you will. I'm going to tell you an interesting story and how I really was introduced to probiotics. It was about 7 years ago when I was flying back from Los Angeles. I had been there for an international irritable bowel syndrome convention and happened to sit next to a representative for a company that makes a probiotic supplement. And my understanding, admittedly, of probiotics 7 years ago was very superficial. He ended up sending me some samples, and I tried it on some patients. Now, the very first patient I go to see that we had tried a probiotic supplement on was a 55-year-old retired school teacher with irritable bowel syndrome and fibromyalgia syndrome. And I walked in the room and I said, "How are those probiotics working?" And she said, "I've got my life back." And I thought that was pretty profound, but I was still a little skeptical. After all, this is patient number one. It was a coincidence, but a few minutes later I go in to see my second patient on the schedule for that afternoon, and I had put her on the probiotic supplement. Very similar story: gas, bloating, diarrhea, constipation, and she also had chronic fatigue syndrome. I walked in and said, "Now this is patient number two." I said, "How are those probiotics working?" She said, "I've got my life back." And it was just very profound. It was almost a spiritual experience for me that both of these patients used the exact same phrase to describe how they were feeling. Well, let me tell you, at that point in time, I was on the internet and learning more and more about probiotics. I recently gave a lecture to the Rocky Mountain Gastrointestinal Nurses Association all about the beneficial effects of probiotics. And I've had countless patients since then who've benefited from the use of probiotics. And again, more than just digestive symptoms. I had a patient who had inflammatory bowel disease for years and had his symptoms resolved after taking a probiotic supplement.